Okay, so last question, I promise. Now, there is so much more I want to talk to you about, and I'm going to beg you to come back and do this again at some point.
To do that.
Because it would be brilliant. I haven't even touched on testosterone. People will be screaming at me. Last question. We know that social media has been a wonderful tool for helping to educate and helping to spread the message. I mean, it's been brilliant for bringing what I kind of refer to as the menopause community together. It's been fabulous. However, you spoke right at the beginning about Google and about quality of information. So there's an awful lot of doctors who are, kind of, they're very, very in touch with all things social media, Twitter, Instagram, Facebook, etc., etc. We know that not everybody always agrees on everything in whatever field you work in. As a patient advocacy organisation, we are very pro factual, evidence-based information. I've got a pretty good idea what I know you're going to say to this, but if you were sort of saying to people, okay, these are the resources that I would feel absolutely you can rely on the information for it being factual, evidence-based, up to date, where would you be pointing, where would you be pointing people like me? Or maybe not people like me, maybe people who, are just learning about this. They're just kind of starting to get to grips with it.
Thank you. That's a very relevant and important question, and I'm glad you raised it, because as you rightly pointed out, Diane, that it has brought lots of positives in raising awareness and supporting people, but it does bring that element of the accuracy of the information. It may well be, a lot of it is well intended, but the question is, how accurate is that information? So I would say, of course, signposting to the right place is a crucial. What you choose to do is, of course, a personal thing.
Yeah.
I might counsel you and say to you, these are your options. And you say to me, thank you very much, I don't want to take HRT. That's a personal choice, but I would be comfortable that you've made it on the correct information.
Yeah.
Or you might say to me, now I was worried about the risk, now I've heard what you've said, I'm happy to take it, or I'll try X, Y, Z, or I'll try a mixture of these. So I would say the British Menopause Society and the tools on it are all evidence-based. They're all produced by the Medical Advisory Council, reviewed by the Medical Advisory Council, and updated regularly. So if you look at our consensus statements, if you look at the tools for clinicians, they're all very much evidence-based, up-to-date, detailed information. Women's Health Concern has got the patient version of them. Now, in my personal experience, I give, even though we say the consensus statements are intended for healthcare professionals, the tools for clinicians, as the name goes, are tools for clinicians.
Yeah.
I give these out regularly to my patients, and patients love them. I get feedback from patients who say, that was really helpful. I've read this and this is really useful. And even though you think it's a detailed document with lots of reference to randomized studies and numbers and statistics. So I think we often feel, I think we underutilize medical documents in that sense. Of course, we need to have both. You need to have patient information leaflets, but I do think the medical documents would be useful. So I would encourage people to have a look at the BMS website there and looking at the videos we've got that really cover most aspects of the menopause. And the documents, the various documents, and of course, any queries. We do get queries as well, not just from BMS members. We do get queries from members of the public saying, I think some of the questions that you've raised today have been passed on to the BMS, and we get back with replies saying, we've heard this about the dose, we've heard this about how you apply the gel, we've heard, and we get back to them with. So again, that's another avenue that if people are not sure what to do, to raise queries directly to us about them. But it is knowing where to look. I mean, Menopause Matters is another website that has got lots of useful information, but it is that aspect, just to make sure that people are getting the correct information to guide them.
Yeah, I mean, I have to say, you know, kind of we write to GPs all the time on behalf of women, and one of the things that we use, which we get really good feedback, is those consensus statements and the tools for clinicians. They find them really useful, but because they are British Menopause Society, they feel comfortable and they feel confident in them. So I have to say, you know, kind of we send those links out an awful lot too.
And thank you, please do, because that's the intention of them. That's the aim of them, is to promote awareness, is to help guide women. That's really the whole objective of them. I mean, even when you're doing it to the healthcare professionals, it's with the intention of applying that to your practice. And you could say, if you're, you know, the woman who's receiving the treatment, or the, you know, that's useful for you as well to know and to be aware of all of these, because they do cover, I mean, if you look at the HRT consensus statement, it covers an awful lot of detail about the risk of HRT with breast cancer, the limitations of it, how you interpret it in numbers. And to lots of people, it answers the questions that people are worried about. It talks about the cardiovascular effect in detail, the bone effect, and on various other aspects, the different progestogen regimens in various areas. So, and that's all on the BMS website. And this document, of course, has now, because of course it was a published article, and it was it's published in the British Menopause Society Journal and PRH. So, of course, before it was available to members, now it's free in the public domain. So the consensus statement, I mean, again, anyone who would like to have a look at it, you don't need to be a member of the BMS. It is free for public, you know, it's available for free download for anyone who would like to have a look at it.
Great. Thank you so much for staying 20 minutes longer than I asked you to. Sorry to publicly get you to agree to come back again. But I really, you know, thank you so much for your time. I really do appreciate it. I'm sure it will be really helpful for lots of people.
You're welcome.
And I look forward to doing it again.
Okay, Diane, you're very welcome.
Thank you so much.
You're welcome. Take care.
Thank you.